Hello, I'm Sophie Scott. Welcome to Health Watch. It's Diabetes Week and there's a major row brewing over the federal government's plan to manage people with the condition. An Australian Medical Association survey shows doctors overwhelmingly reject the plan. The AMA wants to see it scrapped, saying the model is a fundamental shift away from the Medicare system.
It's Diabetes Week and at football grounds across the country the prevention message was being spruiked.
And you're all going to go to different gates, are you, and hands out?
But for the Health Minister, it's another hard sell that's proving more of a problem, getting GPs to embrace the federal government's proposed new model of care for diabetes. The Australian Medical Association polled doctors online and they're far from keen.
They've overwhelmingly rejected the government's plan for diabetes, with less than 4% of the doctors saying they're going to utilise the plan. And this is a fundamental move away from the Medicare system as we know it.
The previous Prime Minister announced the new voluntary system in March as part of his push for health reform. Under the scheme, patients who sign up will have access to about $1,200 a year and a personalised care plan. But the AMA says the money is capped and diabetes patients have to opt out of the Medicare system to join up.
$450 million is a big new investment. We're not going to walk away from that, and I don't think diabetic patients across the country would want us to.
The message from diabetes organisations has been mixed. In New South Wales, a survey has indicated that most people with diabetes don't plan on using the system, while in Victoria, the peak body representing diabetics says the scheme can work.
We noted that the program doesn't start until 2012, so we believe there's plenty of time for us to get the design right.
There's no argument about the government spending an extra $6.5 million for research into type 1 diabetes, which has been announced.
From movies and television to the school playground, new research has found that many teenagers indulge in violent and antisocial behaviour when they hit puberty. Even more alarming, the rate of teenage violence here appears to be even higher than in the United States. These images are becoming more commonplace, evidence that more teenagers are witnessing or taking part in violent behaviour, and new Australian research confirms it.
So I think just really a message for parents is that they should be keeping an eye on their teenage children's behaviour.
In one of the largest studies of its kind, researchers from the Murdoch Children's Research Institute surveyed 6,000 teens in Victoria and the United States. 1 in 10 Australian teenage boys said they'd attacked someone so badly they needed medical treatment. The rate was higher in Australia than the United States, and it was clearly linked to how much teenagers experience the hormonal and physical changes of puberty.
What we found in this study is that students who were in the middle stages of puberty were 3 times more likely to engage in violent behaviour, and the students who were in the late stages of puberty were about 4 times more likely to engage in violent behaviour.
Sydney teenagers say many people don't think about the consequences of getting into a fight.
People get in fights all the time, like every day. People punch on. They don't care.
I don't think they care or realise because they're just so angry and they don't really care what other people are feeling.
Sometimes you can tell when it's going to turn and other times not really. Like you're walking down the street, some dude just goes nuts, comes up, cracks someone in the face. Don't really expect that.
Younger teens were more likely to be involved in bullying and spreading rumours about each other. Researchers say the findings reinforce the importance of prevention programs at school to help teens navigate their difficulties. And American researchers have provided some hope for the hundreds of Australians languishing on organ transplant waiting lists. Doctors at the Harvard Medical School have used stem cells to construct a miniature lung, which function for up to 6 hours when transplanted into a rat. It's early days, but very exciting research. That's all for Health Watch. See you next week.